Good evening. Welcome to the National News Broadcast. I'm Kasumi Balachandra.
And I am Thilina Udayaratna. We begin with a quick check on tonight's top stories.
Fulfilling the national duty, the national television is set to commence the Guru Gedara televised educational program tomorrow. The travel restrictions imposed in the Western province will be lifted from midnight today. The isolation status imposed in several areas will be lifted from tomorrow morning. Some new areas have also been isolated. The passenger transport services to resume in other parts of the country apart from the isolated areas without any hindrance. A Set Pirit chanting program held at the historic Mirisavatiya sacred site invoking blessings on the country and the people. Minister Kehelia Rambukwella says that many decisions have been taken for the betterment of the country during the first year in office of the President amidst various challenges. Nearly half of the global COVID-19 cases are reported from the Americas.
Moving on to those and other stories in detail. The Guru Gedara televised educational program for the relevant lessons for the third term of this year is set to commence tomorrow. The program will telecast on Netra and I channels in Sinhala and Tamil mediums. A period of 16 hours has been allocated in the channels I and Netra of the national television on each day of the week for the telecast of the educational program. The telecast will commence at 4 a.m. The relevant lessons of the main subject streams from grade 3 to 13 will telecast in accordance to a stipulated schedule. 3 subject streams covering grade 3 to 5, 12 subject streams covering grades 6 to 11, and 15 subject streams covering GCE advanced level and grades 12 and 13 are included in the program. In order to resolve any issues pertaining to the lessons of the program, the students can contact a specialized teacher on the relevant subject via the 1377 hotline number. Participating in the Irida Ayubovan program of the national television this morning, State Minister Susil Premajayantha commended the support rendered by the national television for the Guru Gedara televised educational program. The Guru Gedara televised educational program, jointly guided by the Ministry of Education, State Ministry of Educational Reforms, Open Universities and Distance Education Promotion and National Educational Institution, has received the contributions from the teachers of the schools in Western Province, including the mainstream schools.
A Set Pirit chanting ceremony was held yesterday at the Salapatala Malua of the historic Mirisavatiya sacred site to invoke blessings on President Gotabaya Rajapaksa, Prime Minister Mahinda Rajapaksa and the people of the country. The Pirit chanting ceremony was organized to seek blessings to end the COVID-19 pandemic faced by the citizens and the people living around the world to mark the completion of 1 year or after assumption of office by President Gotabaya Rajapaksa and to invoke blessings on the Prime Minister on his birthday. The President and the Prime Minister placed garlands on the statue of King Dutugamunu. The religious ceremony, preceded over by Anunayaka of the Malwatu chapter, Most Venerable Dimul Kumbure Vimaladamma Thera, was attended by 500 bhikkhus from all parts of the island under the guidance of Chief Sanganayaka of the North Central Province of the Siam Nikaya, Malwatu chapter, and incumbent of the Atamasthana, Most Venerable Dr. Palligama Sirinivasa Thera, and under the supervision of the Chief Incumbent of the Mirisavatiya Temple, Venerable Ithalavatunu Veve Jnanatilaka Thera. The religious ceremony commenced after offering the Buddha Puja to the Buddha Mandira at the Mirisavatiya Vihara. Later, the President and the Prime Minister lit oil lamps before the Jayakontya was placed inside the chamber of the Mirisavatiya Stupa. President Rajapaksa, offering the Dahat Vattiya to the Mahasangha, formally invited them to begin chanting Set Pirit. After chanting Set Perit, the Mahasangha included the Anunayaka Theras of the Malwatu chapter and Asgiri chapters and the incumbent of the Atamasthana presenting mementos to the President and the Prime Minister. The President and Prime Minister then offered Pirikara to the bhikkhus. Ministers and MPs, Northern Province Governor, Ministry Secretaries, heads of the security forces participated on this occasion. Seeking blessings to end the COVID-19 pandemic faced by the citizens and the people living around the world, Prime Minister Mahinda Rajapaksa engaged in religious observances at the Jayasri Mahabodhiya premises. Seeking blessings to end the COVID-19 pandemic faced by many citizens and people living around the world, you could see Prime Minister Mahinda Rajapaksa engaging in religious observances at the Jayasri Mahabodhiya premises as well. The Prime Minister received blessings from incumbent of the Atamasthana, Most Venerable Dr. Pallegama Srinivasa Thera during his visit. The Prime Minister also called on incumbent of the Ruwanweli Mahasaya, Venerable Pallegama Hemaratana Thera. Subsequently, the Prime Minister engaged in religious observances near the Ruwanweli Mahasaya premises.
President Gotabaya Rajapaksa is expected to address the nation on November 18th at 8:30 p.m. The special address to the nation by the President will be telecast on all television and radio channels.
Travel restrictions imposed in the Western Province will be lifted from midnight today. Accordingly, the movement between the Western Province and other parts of the country, excluding the isolated areas, will return to normalcy. In addition to the 12 police divisions declared as isolated areas in Colombo, Maradana, Colombo Fort, Peta, Slave Island and Velavidya police divisions will be isolated from 5 a.m. tomorrow until further notice. The isolated areas in the Gampaha district, Nigambo, Jayala, Ragama, Kadawatha, Vattala and Paliyagoda police divisions will remain isolated until further notice, while the Kalaniya police division will be isolated from 5 a.m. tomorrow. The isolation status of the other areas in the Gampaha district will be lifted from 5 a.m. tomorrow. The isolation imposed in the Kurunagala Municipal Council limits and the Kuliyapitiya Police Division will be lifted at 5 a.m. tomorrow. In addition, isolation of the Horana and Ingiriya Police Divisions and the Vakada West Gramaniladari Division will be lifted from 5 a.m. tomorrow. The National Operational Centre for the Prevention of COVID-19 has indicated that the isolation of the Ruwanwella and Mavanella Police Divisions in the Kegal Division will be lifted from 5 a.m. tomorrow. The National Operational Centre for the Prevention of COVID-19 has informed that the activities of the factories functioning under the Board of Investment and the Export Development Board and judiciary proceedings and functions of other essential state institutions in Maradana, Colombo Fort, Peta, Slave Island, Velavidya and Keselvatha police divisions expected to be declared as isolated areas from 5 a.m. tomorrow can resume while adhering to strict monitoring and guidelines of health authorities. Meanwhile, health authorities have in fact taken steps to temporarily impose travel restrictions on a part of the Vikramasinghe area and a section of the Heel Street in the Kalutara South Police Division yesterday. Senior DIG Deshabandhu Tennakon has informed bus associations to refrain from loading and unloading passengers from isolated areas. However, the buses will be allowed to travel in and out of Colombo to other parts of the country. Those bus services have been allowed to utilize the Colombo main bus station. The senior DIG informed that no bus service will be allowed to arrive to Peta from the isolated areas. Also, all bus services and passengers have been informed to use sanitization methods while commuting. Steps have also been taken by the Railways Department to deploy train services without stopping at railway stations in isolated areas.
The National Operational Centre for the Prevention of COVID-19 Outbreaks says that a total of 11,495 COVID-19 recoveries were recorded in the country at present. Meanwhile, 171 COVID-19 recoveries were reported in the country today. A total of 7,096 COVID-19 recoveries were reported in the country since the beginning of this month. The highest number of recoveries was reported on the 5th of November. Another 171 recoveries were recorded today. The percentage of COVID-19 recoveries in the country has increased up to 67.11, while the percentage of active COVID-19 patients currently receiving treatment stands at 32.54. A total of 544 COVID-19 patients were detected from the country today. The patients have been identified as close contacts of the Paliagora COVID-19 cluster. A total of 13,079 PCR tests were conducted yesterday. Accordingly, 638,368 PCR tests have been conducted in the country at present. 1990 ambulance service has been arranged to transport patients in isolated areas who are in need of treatments to hospitals. An ambulance unit has been established at the Meethotamulla School by the Colombo Divisional Health Services Director's Office. The patients can acquire the 24-hour ambulance service via 0113 422 558. Meanwhile, 15 COVID-19 patients have been reported from Uragas Mahanghandia area in Karandini at present. 462 close contacts of the patients were directed to PCR tests. Accordingly, the Karandini Medical Health Office has informed that travel restrictions have been imposed in Uragas Mahanghandia South, Uragas Mahanghandia North, Yatagala and Vallinguru Katia Grama-Niladhara divisions. 7 COVID-19 patients were detected from Yatiyanthore Medical Health Office division. The patients have been directed to Undugoda COVID-19 Treatment Centre in Kegod. Yatiyanthore Administrative Public Health Office said that the patients have been identified as secondary contacts of the patients reported from Paliagora COVID cluster. 44 inmates in Booster prison have been tested positive for COVID-19. The patients have been directed to Gallala and Kandakadu COVID-19 treatment centres in Polonnaruwa. Meanwhile, a quarantine centre which can accommodate up to 40 persons has been established at the Sapagaskanda Mahavidyalaya premises for the police officers who have been identified as contacts of the COVID-19 patients. 5 COVID-19 related deaths were reported in the country today. The deceased patients have been identified as males. One of the deceased has been identified as a 54-year-old resident from Jintupiti area in Colombo 13, and the cause of his death has been determined as the worsening of a long-term cancer condition due to COVID-19 infection. Another deceased has been identified as an 88-year-old male from Colombo 13, and the cause of his death has been determined as COVID-19 infection and cardiac arrest. A 39-year-old resident of Colombo 15 also died due to COVID-19 today. Reports have indicated that he was admitted to Humagama Hospital after identifying him as a COVID-19 patient. The cause of his death has been determined as the worsening of a cancer condition due to the COVID-19 infection. An 88-year-old male from Colombo 12 has died from a chest pain following admission to hospital. The cause of his death has been determined as COVID-19 infection along with a cardiac arrest. Another deceased has been identified as a 79-year-old male from Borella, Colombo 8, and the cause of his death has been determined as COVID-19 infection and chronic respiratory disease. Accordingly, the Director General of Health Services confirmed that the COVID-19 death tally in the country increased to 58.
Chief Epidemiologist Dr. Sudat Samaravira says that compared to other countries in the world, Sri Lanka has been able to maintain the COVID-19 related death rate at a minimum level through the health protective initiatives undertaken in the country. He made these remarks at a media briefing held today.
We have identified that there was some increased number of deaths reporting in our country due to COVID during the past week or two. This has made some concerns among the people. Where are we heading with this increased number of deaths? But you have to compare this with the global context. For example, by now more than 1.2 million people have died because of COVID all over the world. This equals for each 1 million population in the globe, 160 people had died because of COVID-19. In the United States of America, already more than 234,000 people died because of COVID-19. This equals 708 people per million population in the United States has died because of COVID. When it comes to the Peru, it is 1,055 people per 1 million population. In Canada, it is 277. In Brazil, 762. And one of the Latin American countries, Cuba, where there's a very well organized public primary healthcare system similar to our country is existing. There, in that country, the death rate is 11 per million population. And India, more than 126,000 people died. That equals 91 deaths per each million population. In Singapore, it is 5 per million population, and in Sri Lanka, it is only 2 per million population. This reports the World Health Organization, these figures, so that when you compare with other countries, anybody can understand where we are, how we are controlling this disease, and that what can do in future.
Dr. Sudat Samaravira also said that the PCR testing to identify COVID-19 related patients and cases has been carried out continuously within a logical and pre-planned manner, covering the entire country since the beginning of the outbreak.
We are doing in the maximum capacity in our laboratories to identify these cases. Actually, that we are doing these tests in a logical manner and in a pre-planned manner. Even when there were no cases in our country, we were doing this testing all over the country, covering all the medical office of health areas in all the districts in the country, what we called random sampling. We were doing the sampling from the high-risk groups as well as low-risk groups, and also from the people who are coming to the hospitals with COVID-19 like symptoms. That's why that we could identify the Minuwangoda cluster also. So that we are doing this in a logical manner and a pre-planned manner. So now at the moment that we are concentrating more and we are giving the priority for testing those who are under quarantine. When they are beginning the quarantine, sometimes we have to do PCR testing to identify whether they are already infected and whether that they are patients, or at the end of the quarantine period, before that ending the quarantine period, that we have to do a mandatory PCR testing. So we are doing that because that it is very essential to do that before 14 days completing the quarantine period, because thereafter that we have to allow them to go to live with their normal life. So because of that we are giving the priority for them, and also that if there are patients we have to isolate them from the other people in order to not to get the infection to other people. In addition to that, we are doing this testing to identify that in high risk areas like Colombo Municipal Council areas where more and more cases are reporting, we are doing in the community this sampling to identify more cases. As well as that we are doing this testing in the hospitals where that the people come in with COVID-19 like symptoms to identify cases, and actually that we have identify some cases that is all linked to the Paleogoda cluster at the hospitals. Likewise that we are doing these targeted groups, and also that the people who are coming from the abroad and quarantining in quarantine centers, that we have to do this PCR testing, and we are doing this PCR testing to identify cases among the high risk groups, as well as to identify and detect whether there are any other undetected cases among the population. So because of we are at the moment also doing some community sampling also during this time. We know that the WHO, the World Health Organization, has recommended antigen-based rapid diagnostic tests to identify cases. Our laboratories are now they are validating this test. After the validation is completed, a technical committee will provide us a guideline where to do this test, who are the population groups that we can use this test. As soon as these reports are ready, we will be using this antigen-based rapid diagnostic test also to identify more and more COVID-19 cases. With that, we believe that we can increase so that we can accelerate the case finding activities in our country.
Now in news to look at the global pandemic situation, the coronavirus has killed at least 1.31 million people since the outbreak emerged in China last December, while registering more than 54 million cases of COVID-19 across the world right now. Meanwhile, 9,246 new deaths and nearly 608,000 new cases were recorded worldwide yesterday. The countries with the most new deaths were United States with 1,351 fatalities, followed by Brazil with 921, Mexico with 635. The United States is the worst affected country with more than 245,000 deaths from 10.9 million cases. At least 4.1 million people in the country have been declared recovered. After the US, the hardest hit countries are Brazil with more and 81,319 recoveries. Latin America and the Caribbean together have more than 423,000 deaths from 12 million cases. Europe with nearly 335,000 deaths from 14 million infections, and the United States and Canada 256,000 from 11.1 million cases. Asia has reported more than 181,000 deaths from 11 million cases. The Middle East with over 68,000 deaths from 2.9 million cases. Africa with 47,000 deaths from 1.9 million cases. And Oceania with 941 deaths from more than 30,000 cases. Meanwhile, the United Nations Food Agency has warned that the year 2021 will be worse than 2020. The head of the World Food Programme said the Nobel Peace Prize has given the United Nations agency a spotlight and megaphone to warn world leaders that next year is going to be worse than this year. And without billions of dollars, the world will face famines of biblical proportions in 2021.
Taking a look at more local stories, the government's program to provide relief for the people affected in the face of the COVID-19 outbreak is continuing further. Accordingly, during the period from March 31st to the 13th of November, the government has allocated 68.64 billion rupees to provide public relief. More than 12.7 million families have received the 5,000 rupee allowance during this period. In extending relief for the public, the highest expenditure borne by the government is for the distribution of 5,000 rupee allowance for the families deprived of livelihoods. During the period between the months of April and May, 11.3 families have received the 5,000 rupee allowance. Meanwhile, due to the second wave of COVID-19 in the country, more than 1.4 million have received the 5,000 rupee allowance during the months of October and November. A total of 46,411 families have benefited from the program to provide 10,000 rupees worth of food packages for the families which are currently placed under quarantine in their residences. Ministry of Agriculture has spent 126 million rupees to purchase agricultural products with the aim to provide relief for the farmer communities under the prevailing climate. Ministry of Health has spent 4,326 million rupees for the quarantine proceedings, health infrastructure and pharmaceutical supply services. Also, district secretaries have received 78 million rupees for other facilities provided to the public through the district and divisional secretaries. In addition, the government has allocated a considerable expenditure for the outbreak of COVID-19 and related conditions from the provisions allocated for the year 2020 from each ministry.
Minister Kehelia Rambukwala says that the first year in office of the President can be considered as a period with many initiatives and decisions taken for the betterment of the country and the well-being of the people amidst many challenges. The minister said that the implementation of many programs, including the program to provide 100,000 job opportunities, which are considered as significant programs to be undertaken in the history of the country with few shortcomings amidst the outbreak of COVID-19, is a great success. Minister Kehelia Rambukwala said that for the first time in the history of the country, the President is expected to provide 100,000 job opportunities for the unemployed in the country. 40,000 jobs have been provided thus far, and the balance 60,000 job opportunities will be provided following the budget. The government was able to remove the murder allegations levelled against the war heroes through the 30/1 proposal by the Yahapalana government. The government successfully controlled the first wave of the COVID-19 outbreak, and the country is at a justifiable position among other nations faced with the second wave of the COVID-19 outbreak. In addition, the government has successfully implemented the 1,000 National School Program, 100,000 Road Program, and the distribution of funds worth 2 million rupees for each Gram Niladari division in the country. He said that the country consists of 14,022 Gram Niladari divisions. Funds worth 28 billion rupees have been provided for provinces to proceed with their projects. He said that the government has encountered few shortcomings, including issues pertaining to resources, issues pertaining to income earnings, and up to 30 to 35% staff are currently working at the ministries.
State Minister Kanchana Vijayasekara requests the fisheries community not to engage in the trading of fish harvests while placing the products on the floor at fisheries harbours. He mentioned that it is the responsibility of the fisheries harbour to control authority to provide necessary solutions for the trading activities of the fisheries community at harbours. State Minister Kanchana Wijesekara made these remarks while engaging in an observational tour at the Kudavalla Fisheries Harbour. He also stated that purchasing of fish harvests at the fisheries harbours will continue to be carried out with the intervention of the Fisheries Corporation. State Minister Kanchana Wijesekara also emphasised that the government will take necessary measures to protect the fisheries community amidst any obstacles. He also said that he will make arrangements to sink the wrecked fisheries boats loaded at the Kudavalla Fisheries Harbour in Trincomalee Seas. New mechanism will be introduced for the fisheries industry under the recommendations by the Health Ministry. Meanwhile, a program to plant 100 coconut saplings at the coastal garden premises of the Crow Island in Matakkuliya was held today. State Minister Siripala Gamlath engaged in an observational tour in Vilgamo area in Mathale today. Commencement of the reconstruction project of the Vilgamo Kabara Kamandua Anikat, Kusuba Anikat, Thorapitia tank and Sonuttara was the aim of the visit.
Now, in more local stories, the government has taken steps to develop Polonnaruwa, which has been declared as a World Heritage City, into a tourist destination. The decision was made during a meeting of the Livelihood Development Committee held at the Polonnaruwa District Secretariat today. It was organized in parallel to national program to uplift the economy, spearheaded by head of the Presidential Task Force on Economic Revival and Poverty Eradication, Basil Rajapaksa, and Minister Namal Rajapaksa. A joint program has already been initiated to promote Polonnaruwa as a tourist destination. Under the program, a hotel school is expected to be commenced and made in the coming year. Minister Prasanna Ranatunga said that the eco-friendly tourism projects will be initiated in relation to Maduroya, Somavatiya and Vasgamuwa forest conservations. Minister Mahindanand Aludgamage said that an agri-economic centre is expected to be constructed in Gallalla area in Polonnaruwa at the expense of 700 million rupees. He also said that presently suspended farmers' pension schemes will resume from the 1st of January. Discussions were held to further improve the paddy purchasing process as well. State Ministers Roshan Ranasinghe, Shehan Semasinghe, D.B. Herath, Mohan De Silva, Vimalavira Disanayaka and Siripala Gamlath and the North Central Provincial Governor Mahipala Herath were also present at this meeting. Well, that's it on the Rupavahini English News for tonight. Join us once again tomorrow. Until then, take care. Good night.
Good night.